And for more on the new mask guidelines, we bring in Dr. Cameron Webb, who's the Senior Policy Advisor for Equity on the White House COVID-19 response team. Thank you so much for your time, Dr. Webb. President Biden today said that these new mask rules will give Americans, quote, another great reason to go get vaccinated now. How much do you think that this guidance will incentivize people to go get a vaccination, particularly those who are still somewhat uncomfortable with the idea?
Well, I think it's just one more reason to go get vaccinated. There are already plenty. Certainly, one of the reasons is the safety and the efficacy of these vaccines, the fact that it prevents folks from dying or being hospitalized with COVID. But the idea of taking a step back toward normalcy, I think, is an important thing to so many people. And I think that these are the little things people have been missing for the last year and a couple of months. And they're the little things that people are looking forward to getting back to. So I think that it'll help. It'll be a nudge. And also, I think the dynamic that it encourages families coming together and small groups coming together when and how it's safe, I think that's important too, because then you also have that kind of communal, encouragement to get vaccinated as well.
As a member of Biden's COVID task force, can you give us any sense if there was pushback at all to changing the mask guidelines or serious concerns about doing so?
No, not at all. I think that the idea here is that it's a natural progression. As more and more Americans get vaccinated, there are more and more opportunities to move closer to normalcy. And so I think this was just the natural evolution of things. It's the progress that we're seeing. There's still a ways to go because there's still a lot of folks to get vaccinated. But as more people get vaccinated, you'll see more and more guidance that suggests that we're moving closer to normalcy.
We saw images over the weekend of thousands of maskless people at an outdoor concert in New Zealand. Do you think that we might be able to see events like this in this country as early as the 4th of July?
Well, I know, the president has said a more normal 4th of July. I think that's something that we're all hoping for. But what I always say is that it's so important that people realize, the path toward that goal is completely in the people's hands. It's in the hands of the American people. That's, following that public health guidance like mask wearing and physical distance and washing hands, but also getting vaccinated when it's your turn. And, it's everybody's turn. Every adult in America, it's your turn now. So it's the time to sign up. It's the time to get vaccinated. And if we do all those things, we do have a really good chance of having more normal experiences this summer than certainly what we had last year.
We've seen reports on a private school in Miami, the Centner School, that says it will not employ people who have gotten the COVID vaccine, even citing a clearly false claim that standing near a vaccinated person could somehow impact fertility. How do you respond to reports like these?
Well, we respond to those kind of things with the science. We always lead with the facts, we lead with the evidence, and we show people what's true, what's real, and what we know. There's a lot of misinformation and disinformation that's out there. And what we've been doing for the past several months is cutting through that with good facts, with good science, and with trusted messengers. And that's what we'll continue to do. Certainly, we do reach out, and when we hear certain instances like this, and we say, is there anything we can do to be helpful to complement the efforts at the state and local level? But here, I think this is just another example of how important it is for us to lean into the science so that we can get away from some of the false claims that are out there steering people in the wrong direction.
With your focus on health equity, I'd like to ask, just out of curiosity, what does the latest data tell us about COVID cases and vaccine access in traditionally underserved communities and communities of color in the U.S.?
Well, it shows that we're definitely making a lot of progress. Equity has seemed to be a pretty elusive goal in the history of this nation, but with regard to this pandemic, we just can't afford for it to be. And so we continue to press toward that mark. We're making really good progress. And as you can imagine, some spaces, some localities are doing much better than others. We're targeting all the spaces where we can really help out. Our federal channels are making a lot of progress as well. We're having great conversations with state and local leaders. And so, there's certainly still room to go, but I think we're making good progress in that effort. And again, the goal here is for everyone, the hardest hit, the highest risk communities, to have access to the vaccines that they need to save lives and to get us back to normal. And we're absolutely holding true to that goal.
And lastly, we understand that it's still early and that studies and trials are underway as far as children and the vaccine. But many parents are thinking about that now and perhaps hesitant about when it becomes available for my child. Should I get them vaccinated? What's your advice to parents who are kind of having that internal struggle?
Well, my advice to parents who are having that that asking that question is the same advice I've given to family members and friends. It's take your time, study the evidence. As those studies come out, you'll learn about how many people have had access to these vaccines and how they did. My wife and I, we have a 5-year-old and a 9-year-old, and we're planning on having our kids vaccinated, not just for the sake of show, but because we believe it's a way to keep our kids safe. And so I think that as people see more data, and certainly as we see more data, that's what's going to guide our approach. But I think that for everyone, it's really just look at the evidence, listen to those trusted messengers. They're going to guide you on the way. And certainly, this Biden-Harris administration has shown that we're always going to lean into the science. We won't make a recommendation unless it's really data-driven, science-driven. And so, I think that people can trust that at this point, and we want to lean into that for sure.
Dr. Webb, thank you so much for your time. We appreciate it.
Thank you. Take care.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.